A patient came to the Royal Bournemouth Hospital to have an operation on his ankle. Whilst he was in pre-assessment, we asked him how many staff he thought might be involved in his care whilst he was in hospital.
Oh, well, based on past operations, I think it's got to be at least 8, because you've got 2 nurses, you've got the anaesthesia, and you've got the surgeons. So there's quite a lot of people. I think that's I don't really count, so basically I should think it's about at least 8.
Let's see if it's quite as high as that. Before he was even admitted, he received a letter from one of our medical secretaries booking his appointment for pre-assessment. And prior to this, he would have been seen by the team in orthopaedic outpatients. Once his appointment had been made, a set of medical notes were created for his patient journey through the hospital, from pre-assessment to discharge. They were then available for the patient for his arrival for his surgical pre-assessment appointment. He was then given a form to fill in with his personal details and medical history. During his pre-assessment, he was attended by 3 members of staff who took his observations and went through his medical history with him to ensure that all the information was correct in preparation for his surgery. The patient also had a blood sample taken, and this was then tested by our pathology team. We carry out over 3.5 million pathology tests every year, testing bloods and tissue samples, which provides vital diagnostic information. After his pre-assessment, he was sent to have his ankle x-rayed by 2 radiographers. This was just one of over 240,000 scans we carry out at the Royal Bournemouth Hospital every year. The results of this were sent to our medical records department to be checked, scanned and added to his folder by 5 members of staff. This medical record department sorts out the records of over 100,000 inpatients we see every year. In the run-up to the operation taking place, a lot of work was going on behind the scenes to get everything ready for this and the other 21,000 operations which take place every year. Our estates team of over 60 staff ensured that the operating theatre had electricity, lighting, plumbing and clean air filters. They maintain all of the hospital grounds and buildings. Our sterile services department, based at Alderney, saw that all the equipment needed for the operation was cleaned in our autoclave machines, prepared and sterilised with the delivery van driver bringing it across to our theatres in sealed, sterile packets. The team of 30 working on shift patterns produced around 250 to 300 trays per day, adding up to over 70,000 trays per year. Our procurement team of 55 people, including category managers, category specialists and clinical procurement specialists, ensured that all the correct technical equipment and medical supplies, including the patient's ankle prosthesis, had been ordered and were in place ready to be delivered by our goods-in team. This includes the linen needed for our staff in theatres. The fishbowl is the nerve centre of our theatres, and behind this is a team of over 10 staff who are pivotal in generating the theatre lists and staffing rotas for daily procedures. Once everything was in place and ready, the patient then arrived at the Royal Bournemouth Hospital for his operation, parking in our public car parks overseen by our car park attendants. On arrival at the Sanborn Admissions Suite, he was met by 2 of our admissions clerks. During the course of a year, over 570,000 patients come into our hospital either through our emergency departments or as outpatients. He was then seen by the sister of the Sanborn Admissions Suite, who ran through some pre-operation checks with him and did some observations, checking his temperature and blood pressure. She then prepared him for theatre. She fed these into her handheld mobile device. We have a team of 28 IT projects and application support colleagues who keep our applications up to date so notes can be stored electronically on our electronic nurse assessment and other systems. As this procedure is relatively new, the patient was also seen by one of our research trials assistants. He will be followed up over the next 10 years so that we can learn from the procedure to help patients in the future. We have over 2,000 patients currently on clinical trials. The patient then met the 3 surgeons who would be performing his operation and then his consultant anaesthetist. While these meetings were taking place, the theatres team was preparing the theatre, including scrub nurses, healthcare assistants and an operating department practitioner. They ran through a checklist to ensure all the equipment which might be required was in place for the procedure. The consultant orthopaedic surgeon checked the x-rays and demonstrated with a model how the new ankle will be fitted. The patient was then taken to the operating theatre where he was put to sleep by the consultant anaesthetist. After the successful operation, the patient was taken out to our recovery unit. Here he was cared for by a recovery staff nurse, assistant recovery practitioner and deputy clinical leader. There was also a team manning the desk to ensure the smooth flow of patients in and out of the unit. When ready, the patient was handed over to Ward 7 and was taken there by one of our porters. We have over 55 porters at Royal Bournemouth Hospital, which keep the hospital moving, taking patients and goods around the site. Once on the ward, all checked in by our ward clerk, the patient had further tests by the nurse in the ward and had coffee and sandwiches delivered by a healthcare assistant. Every morning, delivery vans arrive at the Royal Bournemouth Hospital, bringing fresh food supplies for patients, visitors and staff. The patient's sandwich was prepared on site by a team of 3, part of our catering team of 27. Over the course of a year, our catering team prepare over 1.5 million meals for patients, using where possible locally sourced organic food freshly prepared on site. In order to plate up the patient's dinner and dinner for over 500 other patients, a conveyor belt system is used in our kitchens, with each patient being able to choose what they want from an online system that day. His food was then delivered to the ward staff by one of our catering delivery drivers in trolleys that keep both hot and cold food at the correct temperature. The next morning, the patient was seen by a fresh wave of staff, including occupational and physiotherapists to help start to get him up and moving, a foundation doctor to check on his progress on the ward, a HCA and the ward sister to help change his sheets and wash him, a member of our housekeeping staff to clean his room, a pharmacist to give him his medication, one of over 400,000 medicines we dispense a year. The patient also met our discharge planner. This is a vital role to help move patients from the hospital back into the community once they are medically fit for discharge. So, over 200 members of staff were directly involved in this patient's care, many more than the 8 the patient thought might be involved at the start of his time at the Royal Bournemouth Hospital. However, this does not take into account the many staff who are providing the support for all the hospital logistics and operations and all the different shifts who oversaw the patient's care. This includes our beat, education and risk management teams. A massive thanks to all of Team RBCH for all that you do to provide care and support for over 500,000 patients every year. And thanks also to the patient for agreeing to be part of this. You were amazing to take part and share your journey.
The care I received today was really exceptional. It always is when I come into the hospital. I mean, like I say, I'm a seasoned pro, so yeah, I believe they look after me very well. That's lovely.